National Cabinet has just announced a $4.7 billion plan to provide ongoing funding for frontline family violence legal and support workers. It comes as pretty welcome news to organisations across the country supporting women and children who are fleeing violent partners.
Now, the Women's Shelter in Armidale, New South Wales, has been providing vital services to families in the region for the last 3 decades. And joining us now from the Women's Shelter is CEO Penny Lamaro. Penny, thanks so much for being with us. OK, your organisation provides a number of vital services, including crisis accommodation. How do you see this announcement by the government helping your area?
Morning, Mon. Morning, Matt. Yes, you're right. The Armidale Women's Shelter has been here since around 1977. We have a little under 20,000 square kilometre footprint, so it's a really large area and lots of people up here in the Northern Tablelands. We've seen about a 25% increase in the last 2 years. So we'll have anywhere from around 600 women come to our door in any year with their children and looking for housing, looking for escape, looking for safety.
Any increase is just horrifying considering what we're talking about here, and that number is really alarming. Penny, just explain how the transitional housing works and what you are able to offer, because as Mon mentioned, the service absolutely vital.
Yeah, look, there's a huge range of services that we offer, much like other organisations like us around the country. One of the important ones is transitional housing. So this is where it's between crisis housing and long-term housing, and it really allows us to address those insidious and invisible harms that come from domestic violence. And many of those harms will continue to affect women and their families for sometimes years. So we have 12 houses around Armidale that look like any other house on the street. The family will be in there. We will be providing some case management support. We're helping out to allow them time to rebuild and reimagine their life post-violence, and also to really have time to get that life admin in order, if you like. That is one of the biggest consequences of domestic violence. When someone is controlling so many parts of your life, it can be hard to keep the balls in the air when it comes to the school for children and your own health and your tenancies and how you look after your friends and your family. And so this transitional housing just gives people a little bit of breathing space. It also allows us, and it's a really important part of moving people out of crises and into that long-term stable accommodation further down the track.
Gosh, Penny, what an amazing service that is. I imagine that you could do with scores more of those transitional houses for women. I'm wondering about this new domestic violence funding announcement that was made yesterday, and it's essentially for frontline services a lot. They are going to look at and report back to National Cabinet about things like alcohol restrictions. But what about turning the tap off? What about men behaviour programs? What do you see needs to be done there?
Mon, what I would say, we talk a lot about violence being a choice, and using violence is a choice. Of course, it's not a choice like most other choices. Most men don't walk around, choosing not to use violence today. For most men, it's not part of their experience of the world. But for the men who are using violence, it's because it makes sense in their experience of the world. So what we really need to tackle this epidemic against women is the resources to deal with that, as you say, to turn the tap off. And ironically, one of the biggest symptoms of domestic violence is that we don't really value the experience of people who've had violence in their life. So when we don't provide quality services to women, to young people and to children who've experienced violence, we sort of make violence a part of their existence and something that could occur later on in their life. So it'll be really, as this money filters down, I'm really hopeful that we get more money and more resources to be able to really upskill our staff and to, provide those really specific services that we need, those therapeutic interventions that we need at a young age and for women immediately after their experience, so that we can ensure that it's not ongoing and that it doesn't, become a lifelong experience. It's just one part of their life that they're able to move forward from.
Yeah.
Well, Penny, you're adding to the offerings. Just last week opened a health service, a nurse providing services to women in the shelters. Absolutely vital. We're really grateful for you giving us an insight this morning. Thank you so much.
Thank you, Matt. Thank you, Mon.